Gastroesophageal reflux disease, GERD. Gastroesophageal reflux disease, GERD, is a common condition in infants and children that occurs when stomach contents flow back into the esophagus. GERD can cause discomfort and complications in some cases, and it is important to understand its epidemiology and prevalence to better diagnose and manage the condition. GERD affects a significant portion of the pediatric population, with studies reporting a prevalence ranging from 1% to 25% in infants and children. Infants are particularly susceptible to GERD due to the immaturity of their digestive system and the lower esophageal sphincter, which may not be fully developed. In addition, children with underlying medical conditions such as neurodevelopmental disorders, esophageal atresia, and cystic fibrosis may be at a higher risk of developing GERD. Given the high prevalence of GERD in infants and children, it is essential to understand the causes, symptoms, and potential complications of the condition, as well as the available medical treatments. In this essay, we will provide a comprehensive overview of GERD in infants and children, including its epidemiology and prevalence, causes, symptoms, short-term and long-term complications, and medical treatments. Understanding this information can help healthcare providers better diagnose and manage GERD in infants and children, ultimately improving their quality of life. The following are the signs and symptoms of GERD in children. 1. Heartburn. Children with GERD may experience a burning sensation in the chest or throat, also known as heartburn. 2. Abdominal pain. Children with GERD may experience abdominal pain, particularly after eating or when lying down. 3. Regurgitation. Children with GERD may regurgitate food or stomach contents into their mouth, which may be accompanied by a sour taste or odor. 4. Difficulty swallowing. Children with GERD may have difficulty swallowing or complain of a feeling of food getting stuck in their throat. 5. Respiratory symptoms. Like infants, children with GERD may experience respiratory symptoms such as coughing, wheezing, or asthma-like symptoms, as stomach contents irritate the throat and airways. It is important to note that not all infants and children with GERD will exhibit all of these symptoms, and some may have no symptoms at all. If you suspect that your child has GERD, it is important to speak with their healthcare provider to determine the best course of diagnosis and treatment. Diagnosing gastroesophageal reflux disease, GERD, in infants and children can be challenging, as the symptoms can be similar to those of other conditions. A healthcare provider will typically begin by taking a thorough medical history and performing a physical exam. Based on the findings, they may recommend one or more of the following methods to diagnose GERD in infants and children. 1. pH monitoring. This test measures the amount of acid in the esophagus over a 24-hour period using a small tube inserted through the nose or mouth and into the esophagus. This test can help determine the severity of the reflux and whether it is causing complications. 2. Endoscopy. An endoscopy is a procedure in which a thin, flexible tube with a camera on the end is inserted through the mouth and into the esophagus to examine the lining of the esophagus and stomach. This test can help identify any inflammation or damage caused by reflux. 3. Upper GI series. This is an imaging test in which the child swallows a contrast material, which allows the healthcare provider to view the esophagus, stomach, and upper small intestine using X-rays. 4. Esophageal manometry. This test measures the strength and function of the muscles in the esophagus, which can help diagnose issues such as a weakened lower esophageal sphincter or other structural problems. 5. Trial of medication. If the healthcare provider suspects GERD based on the child's symptoms and medical history, they may prescribe a medication such as a proton pump inhibitor, PPI, or H2 blocker to see if symptoms improve. If symptoms improve with medication, it can be an indication that GERD is the cause. 6. Evaluation of respiratory symptoms. As GERD can cause respiratory symptoms, such as coughing and wheezing, the healthcare provider may perform additional tests to evaluate these symptoms, such as pulmonary function tests or chest X-rays. It is important to note that diagnosing GERD in infants and children can be complex, and a healthcare provider may use a combination of methods to arrive at a diagnosis. If you suspect that your child has GERD, it is important to speak with their healthcare provider to determine the best course of diagnosis and treatment. Gastroesophageal reflux disease, GERD, can cause a range of short-term and long-term complications and consequences in infants and children, which can vary depending on the severity of the condition and how long it goes untreated. Short-term complications of GERD in infants and children include: 1. Failure to thrive. Infants with severe GERD may struggle to gain weight or may even lose weight due to feeding difficulties. 2. Esophagitis. Stomach acid that repeatedly flows back into the esophagus can irritate and inflame the lining of the esophagus, causing a condition known as esophagitis. Symptoms can include difficulty swallowing, chest pain, and vomiting. 3. Respiratory symptoms. In some cases, GERD can cause respiratory symptoms such as coughing, wheezing, or asthma-like symptoms, as stomach contents irritate the throat and airways. 4. Apnea. In rare cases, GERD can cause episodes of apnea, or cessation of breathing, in infants. Long-term complications of GERD in infants and children include: 1. Erosive esophagitis. Chronic reflux can lead to erosive esophagitis, a condition in which the lining of the esophagus becomes damaged and inflamed, potentially leading to ulcers and scarring. 2. Barrett's esophagus. In rare cases, long-term GERD can lead to Barrett's esophagus, a precancerous condition in which the cells in the lining of the esophagus change, increasing the risk of esophageal cancer. 3. Dental problems. GERD can cause tooth decay and erosion of tooth enamel due to the repeated exposure to stomach acid. 4. Respiratory problems. Chronic GERD can increase the risk of chronic bronchitis and pneumonia due to the repeated aspiration of stomach contents into the lungs. It is important to note that not all infants and children with GERD will experience complications or long-term consequences. However, expect that your child has GERD, it is important to speak with their healthcare provider to determine the best course of diagnosis and treatment to avoid potential complications. Treatment for gastroesophageal reflux disease, GERD, in infants and children typically involves a combination of medication and lifestyle changes. The specific treatment approach will depend on the severity of the condition and the individual needs of the child. 1. Medication. A. Proton pump inhibitors, PPIs. PPIs reduce the amount of acid produced in the stomach and can help alleviate symptoms of GERD. Examples of PPIs used in children include omeprazole, esomeprazole, and lansoprazole. Dosage and duration of treatment will vary depending on the child's age and weight, as well as the severity of the condition. B. H2 blockers. H2 blockers reduce the amount of acid produced in the stomach and can also help alleviate GERD symptoms. Examples of H2 blockers used in children include ranitidine and famotidine. Dosage and duration of treatment will vary depending on the child's age and weight, as well as the severity of the condition. C. Prokinetic agents. Prokinetic agents help improve the motility of the digestive system and can help reduce reflux symptoms. Examples of prokinetic agents used in children include metoclopramide and domperidone. Dosage and duration of treatment will vary depending on the child's age and weight, as well as the severity of the condition. 2. Lifestyle changes. A. Feeding changes. Feeding changes can help reduce reflux symptoms in infants and children. These may include smaller, more frequent feedings, keeping the infant upright for at least 30 minutes after feedings, and thickening formula or breast milk with rice cereal. B. Positioning. Keeping infants upright during and after feedings, as well as positioning them on their back during sleep, can help reduce reflux symptoms. C. Weight management. In overweight or obese children, weight loss can help alleviate GERD symptoms. D. Avoid foods. Certain foods can trigger GERD symptoms in children. These may include spicy or fatty foods, caffeine, chocolate, and carbonated beverages. 3. Home care. A. Elevating the head of the bed. Elevating the head of the bed can help reduce reflux symptoms during sleep. B. Avoiding tight clothing. Tight clothing can put pressure on the abdomen and worsen reflux symptoms. C. Chewing gum. Chewing gum can help stimulate duction of saliva, which can help neutralize stomach acid. D. Managing stress. Stress can exacerbate GERD symptoms. Helping children manage stress through relaxation techniques or counseling may be beneficial. It is important to note that the specific treatment approach for GERD in infants and children will depend on the individual needs of the child and should be determined in consultation with a healthcare provider. 1. Baclofen. Baclofen is a muscle relaxant that has been shown to reduce the number of reflux episodes in children with GERD. It works by reducing the pressure in the lower esophageal sphincter, which can help prevent reflux. Baclofen is typically used in combination with other medications, such as PPIs or H2 blockers. 2. Esophageal pH. Impedance monitoring. Esophageal pH monitoring is a test that can help diagnose GERD and assess its severity. The test involves placing a small probe in the esophagus that measures the pH levels and detects the movement of food and liquid. This can help determine the frequency and duration of reflux episodes and guide treatment decisions. 3. Transoral incisionless fundoplication. TIF is a minimally invasive surgical procedure that can be used to treat GERD in children. The procedure involves using a device to create a new valve at the junction between the esophagus and stomach, which can help prevent reflux. TIF is typically reserved for children who do not respond to medication or lifestyle changes. 4. Electrical stimulation therapy. Electrical stimulation therapy is a new treatment option for GERD in infants and children. The therapy involves placing a small device on the skin that delivers electrical impulses to the lower esophageal sphincter, which can help improve its function and reduce reflux episodes. This therapy is currently in the early stages of research and is not widely available. It is important to note that these treatments are still relatively new and may not be appropriate for all children with GERD. The specific treatment approach for GERD in infants and children should be determined in consultation with a healthcare provider. The prognosis for gastroesophageal reflux disease, GERD, in infants and children is generally good. With appropriate treatment, most children will experience relief of their symptoms and will not experience long-term complications. Short-term complications of GERD, such as feeding difficulties, respiratory symptoms, and failure to thrive, can usually be managed with medication and lifestyle changes. Long-term complications, such as esophageal strictures and Barrett's esophagus, are rare in children but can occur in severe cases or when GERD is left untreated for an extended period of time. The prognosis for children with GERD may also depend on the underlying cause of the condition. For example, children with structural abnormalities or neurological disorders that contribute to their reflux may require more intensive treatment and may be at a higher risk of long-term complications. Overall, it is important for parents and caregivers to work closely with their healthcare provider to manage GERD in infants and children. This may involve regular follow-up appointments, adjustments to medication and lifestyle changes, and monitoring for potential complications. With appropriate treatment and management, most children with GERD can achieve good outcomes and lead healthy, symptom-free lives. Gastroesophageal reflux disease, GERD, is a common condition in which stomach acid flows back into the esophagus, causing irritation and inflammation. In infants and children, GERD can cause a range of symptoms, including feeding difficulties, vomiting, irritability, and respiratory problems. Diagnosis is typically made through a combination of symptoms, physical examination, and diagnostic tests, such as pH monitoring or endoscopy. Treatment for GERD in children may involve medication, dietary and lifestyle changes, or surgery. The prognosis for GERD in infants and children is generally good with appropriate treatment and management.